What if I told you that a simple walk every day after age 60 could do more for your health than some of the medications you've been prescribed? This isn't just talk. Doctors are now saying that regular walking may be one of the most powerful habits for senior health. This video is for anyone over 60 or caring for someone who is. Maybe you started noticing stiffness in your knees. Maybe you get tired more easily or feel your balance isn't what it used to be. These changes are common, but they don't have to take over your life. In the next few minutes, I'll walk you through exactly what doctors are seeing in seniors who stay active with daily walking. From heart health and joint pain to balance, brain function, and independence, this simple activity can change your body in ways you might not expect. Let's start with what walking does for your heart and why it matters more after 60 than ever before. As we move into the first key reason doctors encourage walking after age 60, we have to start with the heart. It's the engine of your body, working around the clock, every minute of every day to keep you alive. And after 60, that engine needs some extra care. Now, here's what many seniors don't realize. Your heart is not just affected by genetics or medication. It's shaped every day by what you do or don't do, and one of the best ways to support it is simply by walking. When you go for a walk, even at a slow pace, your heart rate gently rises. That's a good thing. It tells your heart to work a bit harder, strengthening the muscle and improving how it pumps blood. Over time, regular walking makes your heart more efficient. It doesn't have to work as hard to do its job, which lowers your resting heart rate and reduces strain on the entire cardiovascular system. Doctors who treat seniors often say that a daily walk can be just as effective as blood pressure medication, without the side effects. That's because walking helps keep your arteries clear. It lowers bad cholesterol, which can clog those arteries, and raises the good kind that protects them. It also helps reduce triglycerides, a type of fat in your blood that can increase your risk for heart disease. And the benefits go beyond just the numbers you see in a blood test. Walking also improves circulation. This means your blood moves more easily through your body, carrying oxygen and nutrients to where they're needed. That can help reduce fatigue, cold hands and feet, and even some types of dizziness. When seniors walk every day, doctors often see fewer heart-related issues overall. There are fewer reports of chest pain, fewer trips to the emergency room, and better recovery after surgery or illness. And the best part? You don't need fancy equipment or a gym membership. Just a good pair of shoes and the willingness to move. Let's also not forget that a healthy heart supports every other part of your body. When your heart works well, it helps your lungs breathe easier, your brain think clearer, and your muscles stay strong. Everything starts with circulation, so when you protect your heart, you're really protecting your whole body. But having a strong heart is only one piece of the puzzle. What about the stiffness in your knees or the aching in your back? A lot of seniors believe that pain is just something they have to live with, but walking might be part of the solution. Let's talk about how this simple activity can actually help ease joint pain and keep your body moving more freely. So now that we've talked about the heart, let's move to the joints. For many seniors, joint pain is one of the main reasons they avoid walking in the first place. You might think, my knees hurt when I walk, or my hips feel stiff, I should probably rest. That sounds logical, but here's what doctors are seeing. Stopping movement often makes the pain worse over time. Let's break that down. Your joints, like your knees, hips, and ankles, are made up of bones, cartilage, muscles, and a special fluid called synovial fluid. This fluid acts like oil in a machine. It keeps everything sliding smoothly. But here's the catch. That fluid only moves when you move. If you stay still for too long, the fluid thickens and your joints become stiff, like a car that's been parked for months. Walking helps keep that fluid moving. It gently stretches and loosens the joints, improving flexibility. You don't need to walk fast or far, just enough to get things flowing. Even a few steps around the house every hour can make a big difference. There's another piece to this, your muscles. The muscles around your joints provide support. If they get weak, more pressure falls directly on your bones and cartilage. That causes more pain and inflammation. Walking helps strengthen the muscles that support your knees, hips, and back. Over time, That takes pressure off the joints and makes everyday movements, like getting out of a chair or climbing stairs, less painful. This is especially true for seniors with arthritis. Many people worry that walking will wear out their joints, but doctors say the opposite. Regular, gentle walking actually protects the joints by keeping them stable and well lubricated. Now let's talk about something you've probably noticed: the morning stiffness. You wake up and everything feels tight. Walking, even for just 5 minutes, helps loosen your body and get your day going. It sets the tone for better movement throughout the rest of the day. And here's something many people overlook. When you walk outdoors, you're also getting sunlight, which boosts your vitamin D levels. That helps your body absorb calcium and keep your bones strong. Healthy bones and strong joints work together to support your weight and keep you mobile. In short, walking is one of the best low-impact exercises seniors can do to manage joint pain. It reduces inflammation, strengthens the muscles that support your joints, and helps you move with more ease and less fear of pain. Now, moving with less pain is great, but what happens when your balance starts to go? Many seniors worry about falling, and for good reason. But here's the thing: walking doesn't just help with pain. It actually trains your body to stay balanced and steady. Let's look at how walking every day can help prevent falls and keep you on your feet. 1 out of 4 seniors falls every year. That's a scary number, because falls can lead to broken bones, hospital stays, or worse. But walking regularly can help you stay on your feet. Walking builds strength in the muscles that help you stay upright: your legs, hips, ankles, and core. It also trains your brain to be more aware of your surroundings. When you walk, you're scanning the ground, shifting your weight, adjusting your steps. All of that keeps your balance sharp. It's not just about muscle. Walking helps improve your coordination. It keeps the connection between your brain and your body strong. That's key when you need to catch yourself if you trip. And if you use a cane or walker, don't worry. You can still walk safely and get these same benefits. Balance is one thing, but what about your mood and memory? Let's explore how walking can actually help with depression, anxiety, and forgetfulness. Walking doesn't just work your body, it also works your brain. Doctors have found that walking triggers the release of endorphins, those feel-good chemicals that lift your mood and reduce stress. Many seniors struggle with loneliness or anxiety, and walking can help with that too. It gives you something to look forward to, even if it's just a walk around the block or a chat with a neighbor. Walking in the sunlight can also boost your vitamin D levels, which helps regulate mood. When it comes to memory, walking has another benefit. It sends more oxygen-rich blood to the brain. That helps improve focus, learning, and memory. Seniors who walk every day are less likely to develop memory loss or signs of dementia. Even short walks after meals or in the morning can sharpen your thinking and make you feel more alert. With better mood and sharper memory, you might also notice something else improving: your sleep. Let's talk about how walking affects rest and recovery at night. Sleep problems are common among seniors. Trouble falling asleep, waking up too early, or feeling tired even after a full night in bed. Walking can help fix that. When you walk during the day, you help your body stick to a regular rhythm. Your body learns when it's time to be active and when it's time to rest. That makes it easier to fall asleep at night and stay asleep longer. Walking also reduces stress and tension. You burn off nervous energy and release chemicals that help your brain relax. That means fewer racing thoughts and more peaceful sleep. Try walking in the morning or after dinner. Just avoid walking too late in the evening, as that can leave you feeling too awake to rest. Now let's bring it all together with one of the biggest long-term benefits of walking: staying independent and keeping control over your life. Independence means being able to do things on your own. Cooking, bathing, shopping, even walking to the mailbox. Walking helps you stay strong enough to keep doing those things without help. Seniors who walk regularly are more likely to stay out of hospitals and avoid nursing homes. They recover faster from illness and injuries. They stay mobile, confident, and active in their communities. Walking every day builds a foundation that supports your freedom. It gives you the strength to live the life you want, not one that's limited by health problems or weakness. But how do you actually make walking a safe and steady part of your life? Let's end with a few tips to help you get started and stay on track. Start small. If you haven't walked in a while, Begin with 5 to 10 minutes each day. You can break it up into shorter walks if that feels better. Pick a safe place. Smooth sidewalks, parks, or indoor areas like a shopping mall work well. Wear comfortable shoes that support your feet. If your balance feels shaky, use a cane or walker. Walk at the same time each day to build a routine. Listen to music, call a friend, or just enjoy the quiet. The key is to stay consistent and not give up if you miss a day. And always check with your doctor before starting a new routine, especially if you have health concerns. Walking might seem like a small thing, but over time it adds up in powerful ways. It helps your body stay strong, your mind stay sharp, and your life stay yours. So take that first step, then take another tomorrow. Your future self will thank you for it. If this video has helped you, then I will encourage you to hit that like button and share it with someone who could use it too. Thanks for watching, and don't forget, every step you take is a step toward better health.